Hi everyone, Tim Reha, host of Informed Health 2016 here in beautiful San Francisco at UCSF. Super excited to have Dr. Kate Rankin, who's a professor of neurology and research at UCSF.
Hi, Tim. We just had a great panel that focused on informed health, specifically in precision medicine, and we had a really great lineup of speakers. We actually formed the panel in such a way that it had folks like me, academics, who think about the science. Also, we had two policy folks. One of them was Claudia Williams, who's the Senior Advisor for Health and Innovation Technology at the White House. And the second was Elizabeth Baca, who's the Senior Health Advisor for the State of California Governor's Office. And then we had representation from industry, too. David Shaywitz, who was the Chief Medical Officer at DNA Nexus. So we just had a panel, and we discussed what precision medicine was and what our vision is for how to make it work in the future.
How did you get into this field?
Well, I'm initially a clinical research scientist. I think every day about specifically dementia, where my colleagues and I are trying to understand the mechanisms of how dementias like Alzheimer's disease happen, and specifically how those mechanisms can lead to cures. We want to find patients that have it early, we want to diagnose them right, and we want to cure. And so the reason that I'm on this panel is we think about this from the perspective of how would that process improve if we put together better mechanisms, putting data together, putting interpretation tools, visualization tools together so that we as clinicians and as clinical researchers can accelerate the process of discovery and cure these diseases faster.
It's interesting because dementia is actually a big, huge problem, and we've expanded our lifespan like 30 years with technology and stuff like that, but our brain can't keep up with it. Is that what's going on?
Well, any aspect of science is going to be way too complicated for even a single individual to manage and keep ahead of. And that's one of the reasons why technology is really necessary and essential for improving that process. And not only that, but the way that health technology is moving, it used to be that a person could be a specialist in one area and practice in that area and really make a difference their whole lives. Now, on the research level, for us to understand these diseases, we have to all cooperate. Each of the specialists, each of the clinical scientists in all the different domains have to get together, and they have to interpret their data for the others so that we can see all levels of the person. And that's really what we're trying to do, is we're trying to build systems for precision health, precision medicine, and make innovations in health that allow us to really see the whole person. And that goes for aggregate research data so that we can figure out mechanisms faster, but it also goes for seeing the individual patient right in front of us and understanding their whole self.
Is there preventative causes for dementia? Do we know what it is? Is there cures?
Right. Well, right now there are not cures per se for most of the dementia categories, and that's one of the reasons why we're really in a heated battle to figure out what those are. One of the things about diagnosing a dementia is you can't know for sure what it is for the most part until the person dies, until you can look at their brain under a microscope. And so what we do as clinicians, we end up sitting with a patient and doing cognitive tests and doing brain scans and doing as much as we can to understand what's happening, but we can't necessarily know what molecule we need to treat. And so as clinical treatments are starting to be clinical trials for some of the specific pathologies, as we start to identify those, we're going to need to know which patient should get which treatment. We need to be able to guess what's going on inside of their head. And so we need better and better diagnostics that pull together all that information and interpret it in a really quantitative way for the docs. And so that's a critical issue in my field.
I'm curious about what excites you about being here at UCSF and all the resources that are at your fingertips here.
Well, I have a fantastic cadre of colleagues here. I mean, it's really just one of the world-class institutions in all the kinds of science that I do, and I feel really honored to be a part of that. But I think the other thing that's amazing about UCSF is they have really been on the cutting edge and had a real vision for what precision medicine needs to be and how to build that. You know, the infrastructure here, the leadership here, they're really focused on making this happen for real and being world leaders in that. And I think they've really supported my efforts to build tools and they're really thought leaders in this whole experiment.
Everyone can use new resources, new talent. What are you looking to get out of the conference, and what types of people and companies are you looking to connect with in the space?
I have to say, in the session we just had, I emphasized that as a clinical researcher and as a clinician, I know the problems that need to be answered. I have a sense in my patients, for instance, my patients need brain scans for me to diagnose their dementia. But right now, on the research side, we can quantify those brain scans, but on the clinical side, we're not allowed to use those quantifications. We have none of those tools have really crossed the Rubicon into clinical use. And so we have very specific needs that we can identify. The problem is we don't have the programming resources and that industry has. Here we are right close to Silicon Valley. There are all kinds of people that really can build technological systems that provide the answers that we need. And we need people that can step in and do that. We need companies that are willing to step alongside us and innovate with us. And then we also need policymakers and folks who are really going to smooth the way to allow these sorts of things to cross from research into clinical use, which is really our goal all along. So we need lots of help, but we really feel like we know the problem, and now we just need to gather together at conferences like this and make it happen.
Excellent. Yeah, and it's nice to actually shake hands and meet the people. There's always dynamic folks from David Shayowitz and other folks on the panel. How do people connect up with you?
Yeah, I can be reached. I think the best way is through the UCSF Memory and Aging Center website, which I think is memory.ucsf.edu. Pretty easy to remember. So, and that's really the best way to get hold of me.
Well, Kate, thanks for being on the show. I'm really excited to connect up and see more of what you guys have going off in your departments. And what's next up for you for 2016?
Oh, wow. We're developing a number of tools, and we're going to be trying to get them through FDA approval. So we're excited about that. Well, hopefully they'll be at the bedside soon.
So that's Dr. Kate Rankin here at UCSF. Nice to meet you in person, and have a great weekend.
Thanks for having me, Tim.
Cheers.